What's going on, guys? Jordan here with Prescript.com. Now this video is for anyone suffering from SI joint pain or low back pain. A lot of low back pain does stem from the SI joint. A lot of people just don't realize it because they don't understand what the SI joint entails or what makes up the SI joint. So the sacroiliac joint is essentially the two articulating surfaces from where your spine meets your pelvis. Now this is under a lot of load when we're in the gym because there's rarely a movement of the lower body that doesn't involve the SI joint in some manner. The SI joint controls movement through all three planes of the body simultaneously. So front to back, side to side, top to bottom. So think of each one of these movements as an axis within the body. So front to back, that's your Z axis. Side to side, that's your X, and your top to bottom, that's your Y axis. So we're gonna look at it when we injure this articulation of this joint. There's going to be a functional cast. Your body's going to limit range of motion at that through all three planes. So the SI joint's going to be limited through top to bottom movement, side to side movement, front to back movement. That's why you experience pain. So in order to get out of pain, we're going to have to inhibit the muscles or activate or isolate the muscles that are actually going to be controlling movement through each one of those planes. So first off, we're going to start the X-axis. That's your side to side. So that's going to be your glute med. That's your lateral stability of the hip, and it ties right into the back of that SI joint. Now, something like this, we're going to look at the pigeon pose, which is going to be simply opening up the hip into passive external rotation, trying to alleviate some of that tension at that joint surface of the SI joint. The second one, the Y-axis, that's your top to bottom. So this is primarily controlled by your quadratus lumborum. So it's a muscle that goes from kind of your lower ribs into your lumbar spine and onto the top of your ilium. So the idea here is we're going to do the banded lateral line stretch. We're going to use a band. We're going to open up that shoulder blade. Now, some of you might feel this kind of in the lats. You might feel a little bit higher. That's fine. If this is a problem for you, this is something that you're going to have to stay on top of long term because you want that stretch to centralize through that lateral line and actually start to get in through the QL as it affects the SI joint. So if you're tight in your lats, you're definitely going to be tight in the QL as well. Now, lastly is going to be the psoas, so that's that positive and negative Z axis. So something as simple as a passive hip extension in a couch stretch. You prop the foot up, try and get the knee underneath, neutralize the position of the pelvis, and slowly start to sit back. Again, some of you might find this to be a little peripheral. You might feel it more in your quad than actually in your hip flexor. That's fine. If you have tight quads, likely you're going to have a tight psoas as well. So these are going to be 3 drills I want you to implement if you're having low back and SI joint pain to help alleviate that functional cast that we put on it. So if you want more information about this, I highly suggest signing up for the 2-week free hip and low back pain program at www.prescript.com.